wanted to extend a warm welcome to all our guests who came to our our expansion groundbreaking ceremony. My name is Roy-Shawn Zaval. I'm the Director of Risk Management here at Southcoast Behavioral Health, and we're pleased to have you guys. We would like to start off the speaking program by welcoming Felicia Rizek. She is our Chief Executive Officer of Southcoast Behavioral Health, to the podium.
Thank you, Roy-Shawn. Hi, welcome everybody to Southcoast Behavioral Health. Good morning, thanks for joining us. I was hoping it'd be a little bit sunnier, but at least it's not raining. I was realizing last night, this is the first time a lot of us have seen each other in 2 years. So it's really special for that reason as well. It is an honor to have you here to celebrate the groundbreaking of this expansion. This day has certainly been a long time in the making, having been met with heretofore unimaginable obstacles and Herculean challenges. The past 2 years have been for many the most difficult time of their lives. At the start of 2020, it was reported that 1 out of every 5 Americans struggled with some sort of mental health or substance abuse issue. Now, as a well-publicized corollary to the COVID pandemic, we are seeing even higher numbers across the country of those in need of access to mental health treatment. According to Kaiser Permanente study done in 2021, the number of Americans in crisis has doubled. In many cases, children and adolescents have been impacted the hardest, as their routines and sense of security has been and continue to be upended. Here in Massachusetts, at times, we have witnessed ED boarding levels at double and even triple pre-pandemic levels. We are very pleased to be expanding the facility to help meet the existing and incipient needs of the Commonwealth. We will be adding 48 inpatient beds, increasing our total to 192, and in doing so, doubling our adolescent capacity. We will be adding pediatric beds on these new units as well, as it has been our commitment since we opened our doors to grow our facility to meet the specific needs of the Commonwealth. At Southcoast Behavioral Health, the senior leadership team, medical complement, and all employees take great pride in the significant role we play in providing patient-centered care as we give hope to individuals and families who struggle every day with challenges of mental health and addiction. Our identity and ethos are that of cooperation. I'll wait for the truck. Cooperation internally and externally. Often we receive patient and family feedback upon and after discharge, and it includes comments such as, "You've saved my life, you helped me understand my disease, I wish I would have asked for help sooner." Our community partners often express sentiments such as, "You always answer the phone, you take the most difficult patients, and you are always available to resolve issues." These types of responses and outcomes inform our enthusiasm and stamina even through the most trying circumstances. Honored guests, community partners, area providers, referral sources, I want to humbly thank you for all you do to support us and the communities we serve. I also want to extend a sincere thanks to our partner, Southcoast Health System. This robust relationship has significant valence in our success, and it is through our collaboration that we are empowered to grow and adapt to the rapidly changing landscape. Lastly, to the staff of Southcoast Behavioral Health, it is your dedication to the facility that allows us to continue to serve all of those in need. In this audience, I have the delightful privilege to see the faces of many leaders and staff that opened this facility and now are seeing its second expansion. You are the lifeblood and spirit of this facility, and we certainly couldn't do any of this without you. I am lucky to be the leader of this facility. Thank you.
Thank you, Felicia. We'd like to welcome Renee Clark. She's the Executive Vice President and Chief Operating Officer of Southcoast Health.
Thank you all. First, I'd like to just start by saying a big thank you to Felicia, Dr. Leibovitz, Acadia, and all the staff and leadership here at Southcoast Behavioral Health. Your partnership, collaboration with Southcoast Health is unmatched, and we're very, very proud to be part of this as well. And I think I'll mention, I think we could all relate to the fact that there are young people out there, children, adolescents, who have such promise and hope, and yet somehow they're not getting the resources that they currently need. And we see them every day in our emergency rooms across the country, actually, but also very much so across Massachusetts, where they're just waiting for an inpatient psychiatric bed so they can start their healing, start their recovery, start their understanding. And many times they wait days and days for beds, and they end up in some cases going out of state. And you can imagine how hard that is for a family, a loved one, a caregiver to participate in that healing, and also just to visit and be part of that. So having this here in our community is phenomenal, and will benefit so many people, patients, families, caregivers alike. At Southcoast Health, we're committed to obviously caring for the community, but caring for all members of family and community at every age level. And so we're thrilled to be partnered with someone who has great expertise in behavioral health services. And it's remarkable that 2016, when we started here together, there was concern in the state, at least locally, about our ability to actually fill those 120 beds. And those of us that were close to it and knew what the issues were, we had no doubt at all that we would fill them. So shortly thereafter, we opened another unit here, which was great, and we're thrilled that this next layer, if you will be dedicated for children and adolescents. So the 192 beds is, it's worth the applause. This is amazing stuff right here. So even with that, we know obviously it's not going to solve all of the challenges that the community faces, but it's desperately needed. We have great partners, great clinicians, and an amazing staff here that really care and do great things every day. So we're thrilled to be part of it, and we're thrilled to be here for yet another really exciting phase of our partnership together. So thank you very much.
Thank you, Renee. We'd like to now welcome Dwight Willingham. He's the group president of Acadia Healthcare.
Thank you. First of all, a lot of y'all talk funny around here. So this is Southern, and that is proper English. But I don't have a speech. I just want to say thank you to all of you for coming today. I'm the group president that has responsibility over Southcoast. And I was telling some folks earlier, they gave me Southcoast in like 2015. And I said, why did you give it to me? Did I do something wrong at corporate? And when I first got here, we couldn't recruit physicians. We couldn't recruit staff. It was really a tough place to do business. And over the years, I have seen this place grow with Dr. Leibovitz and the staff, and Felicia has done a fantastic job. And the staff here, this is one of the places that I truly enjoy coming to, because you just, and you're from the north, and people say the people in the north are really mean and quick and park your car and all this other stuff. And so, but you all are really nice here. And so I really enjoy coming here. And it's wonderful to see this place grow. I know when we do, I've got 42 facilities that report to me, and this is one of the few places that I really enjoy coming, because you can see the work that these people do, the quality, the physicians work together, the staff work together. Felicia and her team stay basically full, and the most important thing is that they're serving the community. I want to thank all of you all for coming here. When we did this bed expansion, someone came to me and said, can you do 20 beds? Can you add 20 beds or 24 more beds? And said, we can add 20, we can double that amount and we can fill it up. So we appreciate all the community support, everyone here, and thank you so much. Thank you.
Thank you, Dwight. We'd now like to welcome Dr. Michael Genovese. He's the Chief Medical Officer at Acadia Healthcare.
Oh, just not everyone knows this. Dwight's my twin brother, and we. Thank you, everyone. I do want to thank everyone for coming today and joining us. This is a really special occasion. We've been talking amongst ourselves about what the past couple of years has been like, and so I'm really honored to be here today to celebrate the groundbreaking for this critical expansion. It highlights the growing need that we see across the country for mental health programs for our youth. You know, Felicia, you said it really well. The past 2 years has been, for many, the most challenging of their lives, particularly for kids. I've been talking to everyone here about that today. Behavioral health was at near epidemic levels prior to COVID. Now, as a consequence of it, we're seeing an even higher level of patient need across the country. And the health challenges that these individuals are experiencing, they're more acute, particularly in our youth. Pandemic turned our children's worlds upside down. Social distancing from their friends and family, interruptions in their extracurricular activities that they love, loss of their normal daily activities and routines, exacerbated existing conditions and created new ones. As these health issues have a real impact on our communities and families, those family members can feel helpless. Fortunately, at the same time, we've witnessed the extraordinary efforts of the thousands of mental health clinicians, nurses, and staff who have helped patients in need and get some hope and really look forward to that path of healing. As the largest standalone behavioral health company in the United States, Acadia Healthcare takes great pride in celebrating the significant role we play in providing innovative, patient-centered care and giving hope to individuals and families who struggle every day with the challenges of mental health and addiction. So today, we look forward to the expanded capabilities that Southcoast Behavioral Health will provide at-risk residents in southeastern Massachusetts and Rhode Island. And with these greater capacities will come an increased commitment to work with all local organizations, med-surg partners, and first responders to ease the pain of those suffering. Lastly, I really wanted to add my appreciation to all the Southcoast Behavioral Health staff. They are amazing people. I travel to hospitals all around the country, and the people here are particularly impressive. To Felicia, I mean, your leadership is amazing. You're the heart of the hospital. You deserve a round of applause. So let's thank Felicia. Thank you. I also want to thank Mike Leibowitz. Michael Leibowitz has become one of my favorite doctors in the country to work with, and Michael also deserves a round of applause. Thank you. For all of you here at Southcoast, your dedication and compassion during this very difficult time has made a difference in so many people's lives, and you should take that really seriously and be happy about it. Thank you so much, Renee, and to your team for your partnership. We're so proud to stand beside you as we help patients of all ages regain hope and achieve their potential. Also want to say that I'm sure many of you have heard that Tom Brady is not retiring. He's actually coming back to Massachusetts from what I hear, so things are getting better and better every day. Thank you to everybody, and thank you for being here.
Thank you, Dr. Genovese. I would now like to welcome Dr. Michael Leibowitz to the stage. He is the Chief Medical Officer at Southcoast Behavioral Health.
Thank you, Rayshawn. Good morning, honored guests. It is wonderful to be able to share this event together. This day is particularly meaningful to me. About 5 years ago, I was approached by Dwight Willingham, who was up here earlier. He is the group president at Acadia, with what was described as an opportunity. At that time, Southcoast Behavioral Health did not have a chief medical officer, and he was inviting me to take the helm. At that time, I did not realize how rewarding the decision to come to Southcoast Behavioral Health would be. Over the last 5 years, I've had the privilege to watch the facility grow and be an integral part of what it represents to the community. The need for mental health services, especially among the child and adolescent population, is greater than ever. This second expansion will allow us to provide that much-needed service. Together with Felicia, who was an exceptional CEO, this superlative medical staff that we have cultivated, and our collaborative joint venture partner, and the dedicated team at Southcoast Behavioral Health, we aspire to provide hope and healing to even more of those in need. This is a very challenging population, but with the support of our community and joint venture partners, I know we will be successful. Again, thank you for being here, and thank you for your support. Have a great day.
Thank you, Dr. Leibowitz. We'd now like to welcome Janet Ross. She is the Assistant Commissioner for Clinical and Professional Services and Director of Licensing for the Department of Mental Health.
Good morning, everyone. Southcoast Behavioral Health opened in Dartmouth in August of 2015. I started in my role just 3 months later and have watched as this hospital has grown. First, it expanded to fill the 120 beds originally built here, admitting people from age 13 into their 80s. Then the hospital added a brand new senior adult unit of 24 beds, using the knowledge that they had gained from serving the elderly to design a unit tailored to their needs. Southcoast has been a leader in responding to the state's call for hospitals to admit people who have been waiting the longest in emergency departments. We call them EDs. At DMH, we have something called EPIA, which stands for Expedited Psychiatric Inpatient Admissions. Once someone has been waiting for 60 hours, they're referred to DMH so that we can advocate for their admission. For the past 2 calendar years, Southcoast was the top placement hospital for the people of all ages in EPIA, and Southcoast was the 3rd highest placement hospital in the state for children and youth, having only the adolescent unit. Now Southcoast is doing it again, serving adolescents, but now they're taking what they learned from that experience and building a whole new wing for children and adolescents. It's going to be a dedicated outdoor space, other design features that come from your experience, and we are very, very grateful for your stepping up to provide this service at such a crucial time. The need for inpatient services for children and teens has never been greater. We've all seen the dramatic increase in children and adolescents waiting for inpatient beds. Within that EPIA group that DMH tracks, children and adolescents made up 28% of the total in 2020, and in 2021, it grew to 37% of all referrals. And while it's true that the need has intensified during the COVID epidemic, those of us who have been watching EDs over time know that this was happening even before the pandemic. So I just want to thank Southcoast on the topic of COVID, one of the first to step forward and dedicate a unit to providing care for people who had tested positive for COVID before they came to the hospital. And many other hospitals shied away from that. Felicia and the entire team here at Southcoast stepped up and took the challenge and did a really good job with that. So we thank you so much. We're very grateful for all the ways Southcoast has addressed the needs of the state and the needs of all of our residents in need of mental health care. And we're really looking forward to watching this new addition as it is built. So thank you.
So thank you, Janet. All right. We'd like to now welcome David Mattiotto. He's the Executive Director of Massachusetts Association of Behavioral Health Systems.
Thank you, and thanks. I'm so happy to be here. Thank you for inviting me. This is really a wonderful day, and I go back, people who might not know me, I'm the executive director of our trade association. We have 47 hospitals throughout Massachusetts, all behavioral health inpatient. And we go from the Berkshires, Berkshire Medical Center, all the way down to Cape Cod, and many hospitals in between. And I'm the executive director, so I have the perspective of the whole state. And, you know, I don't need to be redundant. Janet just mentioned how strained, and others have mentioned too, how strained the access is and how full our system is. We have 500-600 people on a given day boarding in emergency rooms in Massachusetts. And we have many patients, many hospitals that are totally full, and we're doing everything we can to meet the needs. I will say Southcoast is an all-star among our group. Out of the 47 hospitals, I'd say Southcoast is certainly one of our top facilities. Although I treat all my children the same. So, but no, as Janet mentioned, Southcoast has really stepped up. The COVID unit, the kids treatment, taking the people off the wait list, the EPIA. And, you know, it's been a wonderful affiliation and a great asset for our group. Felicia and her staff are always on the ball, participate. We meet every week with Zoom, all the hospitals, and every week there is representative of some type from Southcoast, and that's very important. You guys are at the table, you're great participants, you have a great facility. I go back to the very, very beginning with this facility. I remember I've been in this position, if you can believe it. I started when I was about 14, so I've been there 32 years. But I remember when this hospital was being built, and I came down and it was like half built and walked around, and then it got off the ground. And in fact, kind of had a better startup than many of our new facilities. The St. Luke's transfer, I think, helped, and you know, now this was back in 2015. The St. Luke's closed their unit. They come over here. Now then it became 144 beds. Now it's almost 200 after this. It'll be the second biggest freestanding hospital in the state next to McLean. It's desperately needed. All of our hospitals have stepped up to try to meet this need, but as I say, Southcoast has really distinguished itself through the COVID unit, through taking difficult populations. The EPIA list is evidence of that, through leadership with participation, and Felicia's always at the table representing you all very, very effectively. I know this is going to be successful, this expansion. And I want to just say congratulations, and I will do everything I can to help make it successful for you guys and for all our hospitals. We've come a long way, but we got a long way to go, and I'm very, very happy and honored to be here and wish you all the best of luck. Thank you.
Just want to extend a warm round of applause to all of our speakers. Thank you for joining us today. And I would like to call forward the following to partake in the ceremonial groundbreaking. First, Felicia Rizek, Chief Executive Officer of Southcoast Behavioral Health. Renee Clark, Executive Vice President and Chief Operating Officer of Southcoast Health. Dr. Rayford Kruger, President and Chief Executive Officer of Southcoast Health. Dwight Willingham, Group President of Acadia Healthcare. Steve Quigley, Division President of Acadia Healthcare. Dr. Michael Genovese, Chief Medical Officer of Acadia Healthcare. Isa Diaz, Senior Vice President of Strategic Affairs of Acadia Healthcare. Adam Gravely, Construction Project Manager of Acadia Healthcare. Jeff Wise, Project Executive of Berglund Construction. Janet Ross, Assistant Commissioner for Clinical and Professional Services and Director of Licensing for the Department of Mental Health. Dr. Michael Leibowitz, Chief Medical Officer of Southcoast Behavioral Health, and Dr. Geeson, Dr. Alan Geeson, Adolescent Service Line Medical Director of Southcoast Behavioral Health. All right. Sorry, you guys ready? Oh. Sorry about that. All right. So,
Are we supposed to put the hats on?
yeah. There's nothing else in this room. All right. Want to do a count to three?
Not good for the hair.
All right. There we go. All right. All right, thanks, guys. All right, so 1, 2, 3.
I don't know. Maybe put on a gum?
You end up All right. Let's give him a round of applause.